In this podcast episode, Dr. Peter Attia discusses various aspects of health and cognition. He talks about the broken American healthcare system, highlighting the exorbitant charges for simple medical procedures. He explains that the complexity of the multi-payer system, negotiation of contracts between payers and hospitals, and inflated pricing contribute to the problem. The high costs of healthcare can lead to financial strain for many individuals, impacting their quality of life. Attia emphasizes the importance of factors like sleep, exercise, and nutrition in enhancing cognitive function. He mentions that adequate sleep, regular exercise, and a balanced diet are crucial for optimal brain health. He also stresses the significance of creating a conducive work environment free from distractions to maximize focus and productivity. To enhance productivity, Attia avoids phone notifications and schedules dedicated blocks of time for focused work. He prioritizes deep work in the early morning hours when he is most alert and minimizes distractions to maintain high-quality output. By setting aside uninterrupted time and eliminating distractions, he ensures maximum efficiency in his work. While Attia generally avoids supplementation, he occasionally uses caffeine for its ritualistic and taste benefits. He also mentions using nicotine patches for cognitive enhancement, noting the importance of timing and dosage to avoid negative side effects. Additionally, he discusses the use of modafinil for resetting circadian rhythms during travel and jet lag. Attia emphasizes the role of exercise, metabolic health, and quality sleep in reducing cognitive decline over time. He highlights the impact of maintaining cardiovascular fitness, managing weight, and optimizing metabolic health in preserving brain function and reducing the risk of neurodegenerative diseases. By focusing on overall health and wellness, individuals can support long-term cognitive health and function. Attia discusses the evolving attitudes towards alcohol consumption and the cultural shifts observed in social settings. He notes a trend towards more moderate and mature drinking habits, with a focus on quality over quantity. By recognizing the impact of alcohol on health and well-being, individuals can make informed choices and prioritize moderation in their consumption habits. Attia breaks down emotional health into several key components, including a sense of purpose, satisfaction, joy, achievement, quality of relationships, self-regulation, and distress tolerance. He highlights the importance of these factors in maintaining overall emotional well-being. Attia acknowledges the prevalence of negative self-talk and the impact it can have on individuals, especially high achievers. He shares his personal experience of dealing with a scolding inner voice that often reminded him of his shortcomings. He explains how he reprogrammed his self-talk by recording positive messages to himself as if he were speaking to a friend, ultimately reducing the intensity and frequency of negative self-talk. Attia delves into his intensive therapy experiences, where he underwent residential therapy programs lasting 2 to 3 weeks. These programs involved immersive therapy sessions for up to 12 hours a day, focusing on addressing deep-rooted emotional issues and patterns. He compares the therapy experience to mental rehab, emphasizing the structured approach and the guidance of trained professionals in uncovering and addressing underlying issues. When discussing testosterone replacement therapy, TRT, Attia explains the potential risks associated with both appropriate and excessive use of testosterone. He mentions concerns about prostate cancer, cardiovascular disease, fertility issues, and side effects like increased red blood cell production and hormonal imbalances. He also cautions against the misuse of TRT, especially in young men, as it can lead to long-term dependency and adverse health effects. Attia suggests that adequate sleep and stress reduction are key factors in naturally boosting testosterone levels in men. He highlights the negative impact of high cortisol levels on testosterone production and recommends addressing stress and sleep quality to improve hormonal balance. For women, he mentions the potential benefits of DHEA supplementation in enhancing adrenal testosterone production and addressing hormonal imbalances. Attia discusses the NoFap movement, where men abstain from orgasm to purportedly increase testosterone levels and energy. He questions the clinical evidence supporting this claim and emphasizes the importance of understanding the relationship between ejaculation frequency and masculinity. He suggests focusing on lifestyle factors like stress management and sleep quality to optimize testosterone levels. Attia shares a remarkable case study of a 93-year-old man who achieved the physical fitness of a 40-year-old through rowing. He highlights the importance of consistent training and gradual progression in building physical capacity over time. The individual's dedication to rowing in his later years demonstrates the potential for lifelong fitness and health improvements through regular exercise and healthy habits. The story of the 93-year-old rower serves as a testament to the benefits of long-term commitment to physical activity and health maintenance. Attia emphasizes the significance of starting early and consistently investing in one's health to achieve optimal fitness and well-being in later life. He encourages individuals to prioritize health and fitness at any age to reap long-term benefits and maintain vitality as they age. Attia recommends several key supplements for overall health and performance. He mentions magnesium, creatine monohydrate, methylated B vitamins, and curcumin as essential supplements that most people could benefit from. He also emphasizes the importance of omega-3 fatty acids, particularly in the form of EPA and DHA, for their anti-inflammatory and cognitive benefits. Attia acknowledges the significance of water quality and its impact on health. He mentions using reverse osmosis filters to ensure clean drinking water and reduce exposure to contaminants like PFAs found in plastics. He highlights the importance of being mindful of the containers in which food and beverages are stored and transported to minimize exposure to endocrine disruptors. While Attia has not extensively researched the psychological impact of hormonal birth control, he acknowledges the potential implications on women's mental health. He discusses the link between long-term use of oral contraceptives and changes in sex hormone-binding globulin levels, which can affect free androgens in the body. He suggests that the increasing use of hormonal birth control may be a factor contributing to mental health issues among young women. Attia discusses the research on how birth control can affect women's preferences in partners. He mentions studies that show changes in women's attraction levels towards their partners when they are on or off birth control. The hormonal changes caused by birth control can influence women's libido, sexual satisfaction, and partner choice. Attia delves into the debate surrounding the safety of sun cream. He mentions the controversy around the ingredients in sunscreens and the potential risks associated with their use. He highlights the importance of understanding the relationship between sun exposure and skin cancer, particularly melanoma, to make informed decisions about sun protection. The discussion shifts to processed foods and the demonization they often face in the health and wellness community. Attia emphasizes the need to differentiate between different types of processed foods and their impact on health. He mentions that not all processed foods are inherently bad and that it's essential to focus on the quality of ingredients rather than labeling foods as processed. Attia acknowledges the concerns surrounding hyper-processed foods and their potential negative effects on health. He highlights the importance of choosing whole, nutrient-dense foods over highly processed, sugary options. He encourages moderation and mindful eating when it comes to consuming hyper-processed foods. Attia emphasizes the significance of sleep quality and shares key strategies for improving sleep. He highlights the importance of maintaining a regular sleep schedule, ensuring adequate duration of sleep, and creating a sleep-conducive environment. He addresses common challenges with falling asleep and waking up throughout the night. He explores potential reasons for difficulty falling asleep, such as going to bed too early or oversleeping. He also discusses strategies for addressing issues like frequent nighttime awakenings, including cognitive behavioral therapy for insomnia and lifestyle modifications to improve sleep hygiene. Attia expresses concern over the lack of compassion and empathy in online interactions, especially when discussing personal struggles or challenges faced by public figures. He emphasizes the importance of recognizing the humanity and emotions of others, even in difficult situations. He reflects on the need for more empathy and understanding in online discourse. Attia discusses his top 10 exercise choices if he could only do 10 for the rest of his life. He includes exercises such as cycling, rucking, swimming, belt squats, split squats, dumbbell bench press, pull-ups, tricep extensions, hanging leg raises, and seated calf raises.